chess with his granddaughter is Krishnan's favorite pastime. Each day he picks up some smart idea from her for tricking the opponent. Until a few years ago, things were difficult for this 70-year-old. Krishnan kept ignoring the symptoms of what he thought was piles for many years, till it became too hard to ignore.
Initially, for the past more than 30 years, I was suffering from piles complaint. So if you take any spicy items or non-vegetarian items like chicken, that bleeding, occasional bleeding will also come. At that time, consulting doctor and taking some piles medicines only, not surgery, only the medicines. For the time being, it was okay. But like that, I was managing more than 30 years this piles complaint. But in 2013, the problem, till that period, there is no weight loss. Immediately, about 6 kg weight loss. So I was suffering all this pain for 4 to 5 months. Then after consulting this surgery doctor, he advised me to take immediately colonoscopy. In that colonoscopy only, biopsy taken, that positive result for residual infiltrated carcinogenic, so adenocarcinoma present, positive result they have declared. So confirmed result, that biopsy they have confirmed that the cancer growth, anal canal growth.
Once the diagnosis of colorectal cancer was confirmed by colonoscopy, Krishnan consulted a specialist doctor who advised him to undergo chemotherapy and radiation therapy without any further delay. This helped in shrinking the size of the tumor before Krishnan became an eligible candidate for the surgery.
So, Mr. Krishnan came to my clinic with a diagnosis of a low rectal cancer, and he was advised surgery to have that removed through open or laparoscopic. So he came to me for second opinion. So when I looked at his reports, he did have a low rectal tumor, but it was locally advanced based on the CT and MRI reports. Now the current international recommendation for somebody with that stage of tumor is to have something called chemoradiation as a pre-op treatment. Having the chemoradiation prior to surgery reduces the risk of cancer recurrence at a later stage compared to giving the chemoradiation following surgery. So I advised him to have pre-operative chemoradiation to start with. It was a long course chemoradiation for 5 weeks.
Colon resection is a surgical procedure in which a diseased part of the large intestine is removed. The colon is a long muscular tube located at the end of the intestinal tract. After the stomach and small intestine digest food, the remaining material passes through the colon where water and electrolytes are absorbed. The residual stool passes into the last 6 inches of the colon, known as the rectum, where it is stored and released. Colon resection is usually performed to treat colorectal cancers and other serious conditions. The surgeon will begin by making an incision into the abdomen over the part of the colon that needs to be removed. The surgeon will clap the colon in 2 places on each side of the section that needs to be removed. Then there will be a cut through the colon to remove the injured portion along with a margin of healthy colon and surrounding tissues. Finally, the loose ends will be joined together. After the procedure, the surgeon will put drains to collect fluid that may accumulate around the surgery site. Close the wounds with sutures and cover it with bandages. After having a detailed understanding of the procedure, Krishnan underwent a colorectal surgery through robotics in 2013.
For tumors in the pelvis, for example, a low rectal tumor, we need good magnification, a 3-dimensional view, a stable platform like a robotic platform, and all this is available with the robotic technology. And also the instrumentation is such that we are able to do very difficult maneuvers which we may find it difficult with laparoscopic surgery. And I think that's one of the big advantages of the robotic technologies. In his case, his tumor was very low and involving the muscles which control the motion, and so it was not safe oncologically to leave that. We had to remove the entire thing to get a good cancer-free survival, as we say. So we've removed his entire colon, his anus, and given him a permanent colostomy. As I said, prior to surgery, he met a stomatherapist who primed him on how to use the bag, how to take care of it. So he was prepared for it. And we also marked him prior to surgery so that he knows exactly where it's going to sit. And he should be able to put on his normal clothes, and he should be able to go for his walk, go for a swim, play cricket if he wants to. He's done very well. He was, post-surgery, he was in high dependency unit for overnight, which is what our routine protocol is, because he had an epidural for pain relief. The next day he was made to walk. He had some water to drink, and by the next afternoon he was back on the ward. And in the following days, day 2, day 3, he started on a light diet, and by day 4 he was ready for discharge. So he did extremely well, and it was a very uneventful recovery for him.
Previously I thought that it was a new one to me, how to manage this daily affair, this colostomy bag, changing everything, but I used to handle very nicely. Now it becomes very routine. I am more comfortable, even rather regular going to the bathroom. This changing and going, this washing, changing, this colostomy pouches is more easier, convenient to me.
Krishnan had a swift recovery post the surgery and resumed his daily activities in a short period of time. These days, he is often seen speaking to his friends about colonoscopy and its importance. Krishnan has clearly become a strong advocate for colon cancer screening and early detection.
At the age of 50, everyone should take a colonoscopy. A colonoscopy is 100% confirmatory test for if any cancer is there. A colonoscopy, if a biopsy is taken, if a positive result, if it is detected early, the treatment is very, very possible, 100% recovery.
Hello everybody, I'm here to give you an update on Mr. Krishnan. Post his robotic rectal cancer surgery, he's now 2 years and still counting. He completely is cancer free. And he's also signed up for the colorectal cancer follow-up program, which gives him tips on how to live a healthy lifestyle. Mr. Amalanathan has also recovered and he's leading a completely normal life. He now pays very close attention to his health. He actually walks 10 kilometers a day, and most importantly, he is enjoying his life to the fullest. Folks, colorectal cancer is very, very serious. It is the second most common cancer in women and the third most common cancer in men. Early detection is the only protection you have. Life is priceless, so please get assessed if required. Until we meet next week in Let's Talk Health, goodbye for now.